Thank you very much for joining us today on the program Healthy Living. My name is Adisuwa Osa Uwage. We often look at people and say, your eyes are so beautiful. Oh, your eyes are so lovely. Those colors, are they brown? Of course, in this part of the world, you say have brown, we don't have blue. Except, of course, if you decide to, like, enhance it, use artificial lenses or whatever, contact lenses and all that, and then you now start having blue eyes, brown, red eyes, you name it. But when you don't have power over the use of your eyes again, what do? Especially if you had a chance to make sure that you take proper care of your eyes, and in the long run you didn't. I'm sure you're going to live with so much regret, because it's easy for you to save yourself. It's easy for you to protect your eyes, especially. Often the time they will tell you that prevention is better than cure. And so that is why we're going to do something concerning the eyes. And they have called this disease a thief of sight. But how prepared are you? Or how serious are you? Or how committed are you to your eyes? The window to everything that you are. How committed is a big question that only you can ask and answer. Maybe after this program, you will take serious steps of taking care of your eyes. Or perhaps you may also forget about it as one of those things. Well, you will make a decision soon after the program. Join me as I welcome Dr. Momorita. She's a consultant ophthalmologist from the University of Benin. It's nice to have you, Doctor.
Thank you.
And seated beside me is Dr. Darlington Oronsai, Chief Resident, Department of Ophthalmology, UBTH. It's nice to have you ladies in the house. You know, when I saw your name, I thought, it's a guy that's going to be here. But I'm happy to have you. So let me go to Dr. Rita more now. When we say glaucoma, what are we talking about?
Well, glaucoma is an eye disease.
Okay.
Is an eye disease that affects what we call the optic nerve.
Okay.
The optic nerve of the eye is actually that is a structure that takes information from the eye to the brain and tells the brain that this is what the eye is seeing. Okay. So it's a very important structure. And glaucoma...
and where is that structure located?
The structure is located at the back of the eye. It connects the eyeball to the brain. Okay. That's the optic nerve, okay? So glaucoma is a disease that affects that optic nerve and therefore affects the function of transmitting information of what you're seeing. It's a very important disease because it causes blindness. You can imagine if there's a disease that affects that optic nerve, you will not be able to transmit information to your brain. So the person in effect cannot see. So it causes blindness. And it's very important, like I said, because it's a very common disease. It affects a lot of people. In millions. Worldwide, they say over 60 million people are affected.
Like from what age? What age range?
Usually, actually any age can have glaucoma.
Okay,
but it is commoner in older people, above 40. The older you are, the more the risk of you having glaucoma. So the older you are, the more likely you are to have glaucoma. But you can actually have glaucoma affecting even newborn, young children. Okay, so that is how it is. But back to what it is important in that it not only affects so many people, it causes blindness. And the kind of blindness it causes is what we call irreversible blindness. That is blindness that once it has happened, you cannot really reverse it by treatment. You can't reverse it. What we try to do in glaucoma is to ensure that we preserve the vision that you have by the time you are discovered or diagnosed to have glaucoma. So you want to preserve the vision at that stage so that it does not continue to go. So that is so it causes irreversible blindness. Another thing about glaucoma, why it is important, is that it is actually a silent disease. You aptly described it as a thief of sight.
Yes.
It doesn't really give symptoms. It is so quiet.
No symptoms at all?
No symptoms in the early stages. It is in the late stages. By the time you realize you have glaucoma and you are probably not seeing well or knocking down things as you are walking, it means that your vision has actually been seriously affected.
So it suddenly comes on the victim?
It gradually comes. It gradually comes. That's why we say it's a silent thief of sight. No symptoms, and then the disease progresses gradually until once the vision just goes all at once, you know. So it's gradual stealing of sight. That's why we call it a silent thief of sight.
It's still surprising that it does not show any sign.
Yeah, well, it doesn't show any sign classically, because the way it happens, like I said, the pathology is such that the disease gradually comes on, progresses, and causes the damage of the optic nerve from rising intraocular pressure. And then after with that process, that silent process, the patient does not know. And the way in which it takes away the sight is from the periphery. It starts from outside in. So the patient might be looking in front of him and he's able to see things right ahead of him, and he thinks he's fine. Whereas a part of the vision at the side, you know, is going or gone, you know, so he doesn't realize it on time. Most of the time, by the time they start to show symptoms, for example, maybe drivers, they will tell you that when they're driving, they don't see vehicles coming from the side, so they are prone to accidents, you know. And then some people will tell you that, oh, they knock over things and they don't even know the things are in their way. That is how they start to give you signs, and then the patient will say, oh, I'm not seeing well. But classically, there's no pain. For the type of glaucoma which we are talking about, which is the common type, the open angle type, that affects over 90% of people, for that type, there's no pain, there's no clear symptom until very late stages. So that is why we always emphasize this word glaucoma week, that people should check. You have to check for glaucoma, because you want to catch it early. It is when you catch it early that you can treat it, manage it, and not allow it to progress to blindness. And when the blindness has occurred and you start treating, you're just trying to manage what you have at that point. But when it's early and it hasn't really caused blindness, you can control the disease, control the pressure in such a way that the disease, you know, is halted, and then you don't need to get blind from glaucoma.
Okay. You know? All right, let me come to you, Dr. Darlington. Dr. Momodi said that there are types of glaucoma when she mentioned open angle. What other types do we have?
Basically, there are two types. The primary,
just two
types. The open angle glaucoma and the closed angle glaucoma. Everybody has water, fluid in their eye. And so when we say open angle, the water in the eye, or the aqueous humor, is not the angles where they are meant to be, where the water is meant to be drained from, appears open, but there's something wrong with the drainage system. So imagine a sieve or a drain in a sink. There's something wrong within the pipes, so the water doesn't flow through, although it appears open. Then in the closed angle, that's part where it's supposed to drain from. It actually looks like a sieve called trabecular meshwork. It's that place, it's narrow, so the water is not able to flow out as fast as it's being produced. And so there's a build-up of water of the aqueous humor in the eye, build-up of pressure in the eye, and so all that leads to glaucoma.
All right, we don't want you to get scared. We don't want you to be afraid. All we need you to do is call in, and the number is 052-290-573. We have two ophthalmologists seated here. They're doctors, eye doctors, so to speak, and they are sitting here waiting for all your questions. Everything and anything you need to know about this disease, please call in to ask. They say, who ask question, not a lost. So call in now to ask the doctors. You never can tell. Your help may just be now. I don't want to talk too much. I don't want to ask so many questions. I want you to do the questioning, and doctors will give you answers. Since, are there causes? Can you say this is the cause of glaucoma?
Well, we really don't say there's a particular cause, except for depending on the type. There's what you call secondary glaucoma, in which there's a known cause. But that type of glaucoma is quite rare. It affects only about, let me say, less than 10% of people. Is quite rare. The common glaucoma, which we always stress and worry about, the open angle type, there really is no cause per se. But we have what we call risk factors. There are factors that when we identify, We know that from studies that these people who have these factors are more likely
can we just mention these factors?
Develop glaucoma. Yeah, one of it is being black, being a black or African.
Yes.
Yeah, that's
okay. Just being black.
Just being a black person, being from African descent or Caribbean descent, you automatically have a 4 times risk of having glaucoma than the white person.
The white person.
That is one. Then there's also the place for for genetics. That is, it can be inherited. Some people will find that glaucoma is a heritable disease in their family. And it's more common amongst first-degree relatives. That is, among siblings, children, or offspring of family or parents. That first-degree relative, it is more common in them than other people. Then the real risk factor, the main risk factor, is the pressure she talked about, the intraocular pressure. Once the pressure is high, the likelihood of developing glaucoma is very high. And that goes to tell you that sometimes you can have people who have high pressure and they don't necessarily have glaucoma.
How do you test for this pressure?
Well, it's easy. We have instruments for checking for the pressure. We do what we call tonometry. There are different types of instruments. Some of them touch your eye, some of them don't touch your eye. So we just use that instrument called a tonometer to check the pressure, and then we know what it is. There's a normal range. So when it is more than that, we start to worry. But just having the pressure alone is not what qualifies you as having glaucoma. There are other things that have to be looked at, because in damaging the optic nerve, there's a particular way it will show up in the patient's eye. The back of the eye, there's a way it will look, and then we'll know that, when we looked at the disc, we'll say, okay, this person has features of glaucoma. And then the way it even affects the vision, the way you see, it's also specific to glaucoma when it is glaucoma. So all these things you check to make your diagnosis. But going back to the risk factor, we mentioned the intraocular pressure and all that. There are other things. For example, people who have some types of eye conditions, maybe high myopia, who have myopia, that is short-sightedness, they tend to be more prone. Then hypertension is also a factor, but it can be either way. People who have low tension tend to have glaucoma. Then people who also are hypertensive, probably because of the way they manage the hypertension, they can also develop glaucoma or be more prone to glaucoma. So these are some of the risk factors, that we worry about. Hereditary situations, raised intraocular pressure, particularly. Then we also look for other ocular conditions that, like I mentioned.
Okay, let me come to you now, Darlington. What are the treatment options? Without mentioning drugs. What are the treatment options? That is, if there are.
Yes, there are. Okay. So there are medical, surgical, and laser treatment options.
At what stage?
At all the stages. For the medical treatment, that we usually start with that. It's less invasive. That's where the eye drops, the drugs come into play. That's when
the patient is a suspect. So let's put it that way.
When the patient is diagnosed, it takes a short while to actually diagnose the patient with glaucoma. And so once we've made that diagnosis, we'll start the patient on intraocular pressure lowering drugs, the eye drops. Among them are timolol, latanoprost, Bitaxol. They are quite a number. They're both eye drops, and can be in tablet form also, but most of the time eye drop form. And then for the surgery, everything in the treatment of glaucoma is geared towards the reduction of intraocular pressure. And so even the surgeries are geared towards the reduction of intraocular pressure.
Not necessary for the person to see if the disease has really caught up with the person.
No, so that's why we preach early detection of glaucoma. Because by the time it's advanced, by the time it has caused visual loss, there's really nothing much we can do. All we'll be talking about then is trying to stabilize vision at the point where we find it. So it's better treated before it gets to that stage.
In this part of the world where we come from, a lot of us believe in fire brigade approach. You don't get to see a doctor until it is very, very late. What's your message?
I would like people to have annual eye checks, make it a habit to have annual eye checks by the time they are 40 years and above. And then for children, before preschool eye checks, so parents should also make it a habit of checking their children's eyes before they get into school. And then for those who have these risk factors, we've listed out a number of risk factors. You have, if a person has someone in the family that has glaucoma,
yes, that's hereditary.
Yes, so such a person should check his or her eyes annually. So the key really is early detection. So we have a role to play as doctors, and then the populace also, you should, if they have a healthy or a good health-seeking behavior, they will detect it early and then treat before it gets to the advanced stage.
How expensive is it?
Well,
because a lot of people fear financial commitment. How expensive is this treatment?
Glaucoma is expensive to treat. But you know, there's this popular saying that says that if education is expensive, try ignorance.
You're right.
Yes.
That's what I always tell my patients sometimes. I say, look, glaucoma is expensive to treat. Do you want to try blindness? You don't want to try blindness. So we have to make an effort to do what we have to do. That's why we keep preaching. Come and screen, early detection. Because if you catch it early, if you're going to use medical treatment, for example, the drugs you're going to use will probably be cheaper drugs, and you don't have to use many drugs. You may just need to use just maybe one eye drop, and it may be cheap, you know. So that's fine. But by the time it gets more advanced and more aggressive, you have to use more potent medication, and they're usually more expensive. Okay. And these days, we always try to encourage patients to actually have surgery when they have glaucoma, because we have found that in our climb, in our setting, you know, black, the way we, like you have rightly said, we don't want to do anything on fire brigade approach. It's better when we find people who have glaucoma. Most of the time they are getting advanced. If we are lucky, we'll call it moderate stage. So when we get such people, we want to encourage them to do surgery, because you can actually do surgery that will help you in controlling the pressure, even permanently. Sometimes you may still need to use something, but very minimal. But most times you can do surgery, and that will control your pressure for life for some people. For some people, it may not work for life, and then you may have to go back and do something or do whatever. But surgery as a first line is now being advocated for glaucoma because of our behavior and our setting. You find some people, they have glaucoma, you prescribe medication for them, you counsel them, you tell them how to use the medication, that it is for life. Glaucoma medication is for life, every day for life. So it's difficult for people, apart from the expense, putting it every day, you know, all the problem that comes with that. So it's for life. So sometimes it's easier to just do surgery and know that you've taken care of the disease, you know, for a long time. And apart from surgery, there are also options like laser. There are laser treatments that are available.
Okay, we have them here in Nigeria. You have to travel abroad to do that.
We have them here in Nigeria, and they are even becoming more and more available.
We have them in Benin City.
We have them in Benin City, so we can, you know, that's why you need to see a trained specialist to manage your glaucoma, because there's so many things you need to put into consideration to make your decision, you know. And then by the time you start treating the patient, it doesn't stop there. There's also the aspect of monitoring. The patient has to keep coming back to be monitored to ensure that the drugs are working, the operation is successful, is working, and all the problems that you may face in managing the patient, when the patient comes for monitoring, you can, you know, you can intervene if you need to. You can find out what the problem is. You can change drugs if you need to change drugs. Whatever you need to do, you can do. But that can only happen if the patient comes and monitors the condition. So it's not a disease that
it's unfortunate that most people don't even care about their eyes.
Yeah, that's been our experience, and that's why anytime you call us like this to come and talk, we jump at it.
Darlington, is there anything extraordinary that one should do to prevent glaucoma? Is there anything, maybe in the environment, home, food, drugs, lifestyle stuff?
What I would say about that, there's really no way you can prevent glaucoma per se, especially this primary type that we are talking about. The other types, the secondary types, some of them are due to maybe trauma, injury to the eye, or maybe using some medications injudiciously that you're not supposed to use, things like steroids. So we always advise that protect your eyes against trauma, wear sunglasses, especially if you are the kind of person that is an outdoor person that is always exposed to one hazard or risk or the other. Then if you are using medication, make sure you are using the doctor's prescription to the letter. If they say stop, you stop. You don't just continue using medications. Or
you don't just stop before you are told to.
Just like that. So for that, you can prevent secondary glaucomas, that kind of a thing. But for the primary angle glaucoma and the primary glaucomas which we are talking about, you don't really have a way of saying you are preventing them. But generally, because I know what you're getting at, generally, we know that healthy living, eating the right foods, good nutrition, they also help the eye. They help the optic nerve. If you eat foods that are rich in antioxidants, you can help protect your eyes better, in many ways. And we're talking about foods like pawpaw, oranges, vegetables, green vegetables, all these colored fruits, tomato and all that. When you eat such foods that are rich in vitamins and antioxidants, you can protect your eye better than somebody who doesn't.
Okay, the number is 052290573. Please call the doctors. Ask questions. Hello? Hello, good afternoon. Please tell us your name and ask your question.
Yeah, my name is Jeff.
All right, Jeff.
Yeah, I'm trying to find out, I've done a lot of...
Jeff, do me a favor. If you speak up a little bit, I'll be able to hear you.
Okay, I said I've done a lot of checkup.
Okay.
I use my eye drops. I use glasses. I'm hypertensive. But I've noticed something. My vision, when I'm driving, at times without my glasses, it becomes so blurring at times. And severally, I've complained to my ophthalmologist, who keeps saying I don't have glaucoma. So, what is really because of one having that blurry vision?
Okay, that's very interesting. What's the caller's name?
Jeff.
Jeff, okay. Jeff, I'm happy you said you have seen an ophthalmologist. So I want you to trust what your ophthalmologist says. If he or she says you don't have glaucoma, you probably don't have glaucoma. The thing is that there are many eye conditions and diseases that can have the same sorts of presentation. So you can have blurry vision, like you said. You can have it affecting your driving, like you said, and all that. So the important thing is your doctor should be able to find out what is wrong with your eyes, what is causing the problems you have, because from what you have said, you obviously have some probably a refractive error. So they should be able to check, do some tests for you, and determine what the problem is. So just maybe you should go back. Sometimes the problem is that patients don't go back. You don't give feedback. If the doctor has treated you and said, oh, this, if you are not satisfied, you should go back and complain and let them check again. And I'm sure they'll be able to find out what the problem is. Glaucoma is very easy to diagnose. Anybody who is trained can diagnose glaucoma. So if your ophthalmologist says you don't have glaucoma, I'd like to believe that. But if you don't believe her, you can also always go for a second opinion. You can go somewhere else and have your eyes checked by somebody else. It's perfectly in order.
Thank you very much, ma'am.
Yeah.
Okay, Jeff. The number is 052290573. The number is right there on your screen. Do give the doctors a call. Call them and you'll be happy you did. Hello.
Hello, good afternoon.
Good afternoon, lady. Tell us your name, where you're calling from, and hit.
Hello, good afternoon.
Good afternoon.
Good afternoon.
Good afternoon.
Good afternoon.
We can hear you. We can hear you. If you reduce the audio level on your television set, or you move away completely from where your TV is, then we'll be able to talk to each other. Hello, good afternoon.
Hello, can you hear me now?
I can hear you.
Yes, we can.
Okay. I appreciate the program.
Can you tell us your name first?
Okay, I'm Mrs. Osifo.
Okay, nice to hear from you.
I actually visited an ophthalmologist before.
Okay.
He gave me glasses that I'm using.
Okay.
But I noticed there is a growth in my eye. No eye drop was given to me. I don't know if that can lead to something else.
Okay.
Okay. So you're worried about the growth?
Whether it will have any effect or it has a timing for rejecting the glasses or something.
How long ago did you see your doctor?
You said?
How long ago did you see the doctor?
And it was during an annual campaign like this.
Okay. So probably about a year ago. Okay.
For last year.
Okay.
Okay.
Mrs. Osifo, like Dr. Momo said.
Hello?
Can you hear me? Hello?
Hello?
Okay. Like Dr. Momo said, there are many eye conditions that can affect the eye. In your case, you've told us that you have a refractive error and a growth in your eye. I'm guessing that it's either a pterygium or a pinguiculum. But to know which of the two I just mentioned, you have to talk to your ophthalmologist.
Okay.
So
it's okay.
And usually either of these two I mentioned, they are slow growing, and so sometimes they may not place you on medications. But I would advise you to what?
Okay.
Because I should visit.
Yes,
visit your doctor, your ophthalmologist again,
and make sure you have a comprehensive eye check.
All right.
Yes.
Okay.
Thank you
very much.
All right, we're moving on the program. And I got this one. She says she's Mary. She sent a text message that her name is Mary, and that she had to go and pick her father up from somewhere when he called to say that he suddenly went blind. And she's asking, could this be glaucoma? She said she had to go and pick her father up sometimes last year, that the father just suddenly went blind. And today they've not gone to the hospital because they think it's more spiritual. That watching this program is giving her another opinion about what happened to the dad.
Okay. Yes.
There are many causes of blindness, and especially sudden loss of vision, sudden loss of sight. Glaucoma doesn't really cause sudden loss like that, but it can. It can, especially in the last stages. But by the time you are getting there, there already have been signs of poor vision. But the best thing is for her to take your dad. Please take your dad. You never know. It could be something that is even treatable. It could be a cataract. It could be something else. Okay. So take your dad, let them check the eye, and determine what the problem is. There are many things that can cause loss of vision. So you just really need to check. One cannot say by just what you say, because you have to tie your symptoms with your signs, with what you see in the eye. So that's what I would advise you to do. Don't give up. Don't think it's spiritual. And it's a problem here. Many people have eye problems and they will say it's spiritual. Meanwhile, it's one simple thing that could have been, treated, and the vision comes back. So just take them to the hospital and let's know what is going on.
Okay. All right. I hope you got that, Mary. I know you're watching, and I'm very happy that this program is giving you new ideas of what to do. So please do go to the hospital. Whether they go to UBTH or any government hospital, okay, you will find specialists there who will treat your case. Forget about the long wait and all that, okay? Hello, good afternoon. Hello? Can you reduce the audio level on your television set, please? Hello, good afternoon.
Hello.
Hello?
Good afternoon.
Good afternoon. Your name, please.
My name is Osamudia.
Okay. Osamudia, please, can you go away from your television set, please?
Okay, no problem. I'll do that.
Okay.
Can you hear me now?
Yes, we can.
Yes, we can.
See, I've been having this eye problem for more than 5 years now. Hello?
Hello, we're hearing you.
Okay, somebody hit me from my left eye side. So since then, I've been having this pain. So I normally attend UBTH.
Okay.
Since 2017, throughout 2017, I attended UBTH for treatment. But throughout last year, I did not feel the pain. But suddenly, last week, I started feeling the pain. So the thing will just be paining me as if the eye bulb inside wants to fall down.
Okay, Madam Faith, is that all?
Yes, and it will be red. I can't even use it to see light or sun if the sun is too much.
Okay. But you can see.
Yes.
But you can still see with the eye.
To see, but it depends.
Well, you are having pain.
I will just close the eye.
Okay.
Yes.
Okay. All right. So
Okay.
Hello.
I can hear you, ma'am.
You're already a patient of UBTH. You can come any day. There's always a doctor on call or a doctor on duty that you will be able to speak to.
Hello?
I said you can come any day for attention.
Any day?
Yes, there's always a doctor, especially now that you're having pain and redness. There's always a doctor on duty.
But normally to see a doctor at UBTH, you know, Tuesday and Thursday.
no.
We see patients every day.
Every day except Wednesdays.
Except Wednesdays. Even on Wednesdays, there's still a doctor on duty seeing patients outside of the clinic.
We run a special clinic on Wednesday for diabetes, for people who have diabetic eye problems. And then we see patients who have any emergency or any complaints with their eye. So if you come in, you definitely see a doctor in the hospital. And from what you have just said, I want you to come straight away. Okay? You need to come straight away to see a doctor. Something is probably going on there that is not quite good. So you need to come straight away. Okay?
Thank you.
All right, the numbers are still there. Please do well to call us. We got a text message from John who says he was slapped. He said he was slapped some time ago, like 3 years ago. And since then, he has been tearing from that eye. And watching this program is giving him some creeps.
Well, what I would like to say about, most of the time when people call in to make complaints about the eyes, in fact, even about the body generally, it's usually better to have that eye checked up, because there are many things that present almost the same way. And no good doctor will ever give you a diagnosis based on what a patient says alone, because they are right.
They need to see you.
You need to be seen. You need to be seen, because there are many things that can mimic the same thing. And from what he has described now, he had trauma some years back. I mean, somebody hit him in the eye, and he says he's been tearing from that eye. That means he ought to have come in a long time ago to check the eye. There are a myriad of things that can be going on. There are many things that can be going on in that eye right now. So he needs to come, and then we'll check and determine what it is, and then treat him. So if he still has vision in that eye, it's a good thing. So let him come in right away.
Okay, so I'm sure you heard the doctors coming right away, as in now. Don't joke with your eyes. I mean, that's one part of the body. I mean, you're not to joke with any part of your body, but the eyes, you just cannot afford to joke with your eyes. Okay, we're still here on the program and looking at glaucoma. It's a very serious disease, according to the doctors. Hello, caller, good afternoon. Hello? Yeah, good afternoon. What's your name, please?
Joy.
Sorry?
Joy.
Joy.
Yes.
Okay, Joy, go ahead with your question.
I have an eye problem.
Okay.
The can't see very fast.
Can you start again, please?
We didn't get you.
Hello, Joy. Joy? Okay, I guess we lost that call. Please call us again. And when you're calling, reduce the audio level of your television set. It's not too difficult to do. Or better still, move away completely from where your television set is. By so doing, we'll be able to talk to each other. You'll hear us, we'll hear you. If you leave the TV audio on, the echo will really disturb us. All right, while we're waiting for more calls, shall we look at the side effects of drugs? Okay, we have a call. Hello? Hello?
Hello?
Hello, can you speak up a bit, please?
Hello, can you hear me?
Yes, we can.
We can.
Hello? Okay, we lost that call. Okay, while we're waiting for more calls, doctors, let's look at the side effect of treatment. Is there any?
Of course, when every medication has side effects. So for some people are allergic to the eye drops, the components, either the active components or something that was one of the other components in the eye drops. And some people have discomfort when they use these eye drops. They complain of this peppery sensation.
Okay.
Some people can have some redness and maybe an itching sometimes. But usually for many of the eye drops that would cause redness, they would after the first 1 or 2 weeks, it usually stops, and then nobody knows anymore. Then some people could have increased palpitations with these drugs, and awareness of their heartbeats. Some of them may have difficulty breathing, but not everybody has these side effects.
So yes. What are they supposed to do when these side effects start occurring?
They see their doctor. Immediately they shouldn't discontinue on their own. They should come to see us, and then there are other options.
Okay. Hello, caller.
Hello.
Reduce the audio level on your TV set. Hello.
Hello.
Yes.
If you move away from where you are now, we'll be able to hear you. Okay, we'll talk to you again later. All right, please, if you want to call us, reduce the audio level on your television set. That is, kill the volume, come out the volume, or you move away from where your TV set is. Then we'll be able to talk, okay? Because we're talking something very serious here. If you do not reduce the audio level, we'll not be able to hear you. All right, let's look at those persons who patronize alternative medicines. Okay. Like some will tell you, doctor, don't talk it. Let me go to one corner and get this thing. You know? Hello? Okay. Hello? All right, that caller is very busy enjoying himself there. So let's continue what to say. There are so many people who like to visit alternative medicine. Like they will tell you, oh, you bought medicine, good for my body. You know, there are people like that. Because the other day, I actually saw somewhere in Benin City, I actually saw people running towards a vehicle. The person was selling drugs. This one they cure cataract, this one they cure glaucoma. And I know glaucoma has got no cure. And you see people going there, this one they cure glaucoma, this one they cure this one. Any eye problem. And people were rushing towards it. It's not in my place to halt them. You know? So what do you tell such persons?
It's a huge problem in our environment, you know, proliferation of all this alternative medicine. Everybody does have a right over how you take care of yourself. That is the fact, you know. But as we become more aware and enlightened about things, it's also supposed to affect the way we behave towards our health. The eyes, I always try to talk to patients that the eyes are not something, it's not that part of your body that you should joke with in terms of alternative medicine or using any kind of preparation. The eyes are very sensitive. They don't tolerate injuries. if you injure the eye in any way, by just causing any slight injury to the eye and having an inflammation, the end result of that inflammation is scarring. And that scarring means blindness. The scarring in the eye means blindness. If you injure your skin, you know, if you injure your skin and it heals, you have a scar. But it's your skin, it doesn't matter. It doesn't matter, you just forget about it. But in the eye, it affects your vision. So you will lose your vision. So there are many things that people mix, many concoctions that people mix, and many practices that people, carry out. Some even for babies, for young children, for babies, when their children are having eye problems or they are ill, mothers will easily put breast milk, all those
onions,
things. Put onions,
or pepper.
Yes. And then some people will even go as far as putting, urine and things mixed up in their eyes. So many concoctions. Leaves, they will squeeze leaves, and these leaves have toxic constituents as well as germs. They are rife with germs, and they put it in the eye, and that the eye is such a warm place. It's looking for that germ to to proliferate. The eye is a good place for germs to proliferate. So if you allow germs to enter the eye, it's usually disaster. So we advise people, please, I beg, don't do that. Don't put things in your eye that you are not completely sure that is not from a doctor, or from a doctor's prescription. Because those things that are prepared outside, even if they are good, we don't know how they prepare them. We don't know the environment in which they are prepared. We don't know how aseptic they are. So the eye does not tolerate anything like germs. So you don't want to put anything in your eye that would affect your eye ultimately. If it is food, if you talk about food, no problem. If you're eating all kinds of food, they say you should eat this or eat that. And then even maybe some of these vitamins, if it's vitamins you swallow, they say, use this, I know a lot of this, what do you call them?
Like
all this
all those there is one that is trending on social media now. If you want to research on something, the drug will just pop up. Oh, this drug cures glaucoma, this drug cures cataract, this drug will take your glasses. In fact, you will dump your glasses in the dustbin. You will never remember your glasses again. And you see people trying to get this drug. What's the dangers behind all of this?
I just call them big scammers. They're big because if you go deep, you find that you cannot even trace the people who are putting these things out in social media. You can't trace the company. You can't trace who is in charge of that, that whole establishment. So they are scammers. They will just put some things. They may not harm you, but they don't do those things that they claim to do. Many a time they don't do those things that they claim to do. Before you can say something can cure this. Scientifically, we need to have it researched. We need to have it published. We need to have it trials, what we call clinical trials. When we do all that and we can see the effect and we document it, there is evidence. That is when orthodox medicine will not take it on as something that you can use. So there's evidence for what we do. There's no evidence for drugs that will cure cataract. They are trying. There's research going on. There are many organizations and laboratories that are, researching into finding alternative ways. Fine, they research, but as at this moment, there's no proven drug that is used for treating cataract. Glaucoma, the drugs we have for glaucoma the effective drugs is to control the intraocular pressure, to control the pressure. It doesn't cure the glaucoma, but it controls the pressure in such a way that the glaucoma does not progress. So that is what we have. Even the surgeries we do right now is to also control the intraocular pressure.
Okay, let me let you answer this question that was sent in by one Mr. Osas. Okay, Osas says that he finds it very difficult. Like he usually bashes his car on the right-hand side, because he finds it difficult to see if any vehicle is coming from his right hand, but the left one is okay. And then sometimes he has to ask people if the weather is very clear or if it's his eyes that are deceiving him. So he's wondering, could this be a sign of glaucoma?
It could be.
Usually he bashes his car on the right-hand side mostly. That is, maybe if he wants to enter the road or something, but he says on the right-hand side, but it's good with the left-hand side. And then when he's driving, he needs to ask people that he does not drive alone. He needs to have somebody in the car and ask people, is the weather clear enough, or is it his eyes that are deceiving him? I think this young man is worried. We don't know how old is he anyway.
Okay, Mr. Osas, I would advise that you please come to the hospital. When you come to the hospital, we're going to do something called a dilated fundoscopy. Just put eye drops in your eyes so we can examine the back of your eyes properly. And when we do that, we can give you a proper diagnosis. So and we also do a visual field for you. And so I would advise you quickly come to the hospital so we can do all that for you and make a proper diagnosis. We can't make that diagnosis now until we've examined you properly.
Let me ask, when patients want to come to UBTH, do they come straight to the eye clinic, or they have to go through a long process? I'm sure that's what is scaring people.
Well, there are many ways you can come to the hospital. There's a general outpatient clinic where you can walk in, whatever the problem you have. Yes. You walk into the general outpatient clinic and they will see you. A doctor is there that will see you. And if you have an eye case, they'll quickly give you a note to come straight to the eye clinic. And then we will take it up from there and see you. Then doctors can be seeing you from their clinics in any part of the state and refer you to us if they feel you have an eye problem. Then you cannot actually walk in also into the eye clinic. The UBTH eye clinic, you can walk in. We have a way of sorting out cases that walk in. If it is absolutely important that we see you, if it's an emergency, or we will see you right away. But if we know that it is not an emergency, it is probably what we call a cold case, we will give you a referral for you to come, because we cannot possibly attend to everybody that comes. So we have a way of sorting out how you should be seen. And then we also have a Center for Disease Control in the University of Benin Teaching Hospital, where we see people who just want to screen themselves.
Okay, so anybody can just
anybody can go to the CDC. If you go to the CDC, you can screen not just glaucoma, every part of your body. You can screen for breast, ovary, cervix. Men can screen for prostate glands. They can check for hypertension, diabetes, whatever you need to screen for. You go there, and then we also have points there where we screen for glaucoma, especially for glaucoma. So you can do that. Then we have outreaches apart from UBTH. We have outreaches at IGBA, Primary Health Care Center at Ikobauka. We go there every Friday to see people, people who can't come all the way to UBTH. So there are actually quite a number of avenues to get attention.
All right, people, we're talking glaucoma today on the program Healthy Living. And I'm sure you've been educated. You're a little bit informed, more than you were. If you are still in doubt, please go to the hospital. Like Mr. Osazu says, he finds it difficult to, like he's always bashing his car from the right-hand side. I think you should go to the hospital. Mary, she sent a text to say that the father suddenly went blind. She had to go and pick him up from where he was, See a doctor. It does not cost you anything. Like the doctor said, and from what I've seen, glaucoma is a silent thief. No symptoms, no pains. It will just come unexplained, okay? And then you begin to wonder. It's got nothing to do with anything spiritual. Just go to the hospital and find yourself and get yourself checked. Now, doctors, before we go, open angle glaucoma you talked about. Can you describe it? Is it possible for one to self-diagnose?
No.
Is it something you can do? Because when Osas sent this text, I was like, could this be one of the symptoms of this open angle glaucoma?
No, not
the open angle. Because he's seen from one angle.
No, not
so to speak. So
no,
the other angle.
No, it's not. What he's describing has nothing to do with angle.
Okay, can you describe that angle?
It just has to do with the fields, how well he's seeing, in different directions. The open angle is a situation where the eyes are shaped in such a way that you have an aspect of it that leads to where the drainage structures are. Like she described it for you earlier on, that the drainage structure is the trabecular meshwork, and then you have the anterior chamber, which leads to that trabecular meshwork and which helps the eye to drain the fluid within the eye. So it's usually open. The way it is open so that the fluid can get to that trabecular meshwork to get drained, okay? And that is what is supposed to be. But in glaucoma, in the open angle glaucoma that we talk about, that angle, that channel is open for the fluid to get there, but that drainage the drainage structure, the trabecular meshwork, over time starts to get degenerated. It starts to degenerate. It starts to lose its functions. It's no longer able to carry out its function properly. There's a word we use to describe it, that it gets sclerosed, but it just starts to lose its ability to function properly. So it's like you have, when you are washing plates and things plug your sink.
Yes, so
water may still be, and she explained it earlier to you, explaining.
Yes.
Water can still be draining little by little, but because of that dirt and everything there, the water cannot flow. You understand? Because there are some things there, there are things there that is not making it to drain properly. It could even be down in the pipe, but it's not draining properly because there's some kind of blockage there, so that's what happens. So, but in the closed angle type, that channel to even get to the sieve is not there, it's closed. The pathway, the road to pass, so to speak, to get to that structure is closed up. So the fluid does not even get to where it is supposed to drain. The fluid does not even get there. In the open angle, the fluid gets there, but it doesn't drain properly. In the closed angle, the fluid does not get there at all. So that is how it is.
I must thank you, doctors, for finding time to be with us on the program. So Dr. Momo Rita, consultant ophthalmologist at the University of Benin Teaching Hospital. Thank you very much for finding time to be with us here today.
Thank you.
And Dr. Darlington Oronsaye, Chief Resident, Department of Ophthalmology, UBT here. It's nice to have you join us today. So thank you, ladies.
Thank you very much.
And I'm very glad you ladies were here. All right, people, your eyes is your business, and your eyes is the window with which you look into the world. Take good care of it. We'll see you again next week. Bye-bye.